An abdominal hysterectomy is a surgical procedure in which the uterus is removed through an incision made in the abdomen. This operation is one of the most common gynecological surgeries performed worldwide. It's a significant decision for any woman to make, as it permanently ends the ability to bear children and can have various effects on the body. In this video, we'll explore what an abdominal hysterectomy involves, why it's done, how it's performed, the recovery process, and what you can expect after surgery. So, what is an abdominal hysterectomy? An abdominal hysterectomy refers to the surgical removal of the uterus through an incision in the lower abdomen. The uterus is the reproductive organ where a fetus develops during pregnancy. When a hysterectomy is performed, it removes the possibility of menstruation and the ability to become pregnant. There are different types of hysterectomies depending on what parts of the reproductive system are removed. Number 1. Total hysterectomy. This involves removing the entire uterus, including the cervix. This is the most common type. Number 2. Partial or subtotal hysterectomy. In this procedure, only the upper part of the uterus is removed and the cervix is left in place. Number 3. Radical hysterectomy. This is a more extensive surgery that involves the removal of the uterus, the cervix, part of the vagina, and surrounding tissues. It's usually done when there's a diagnosis of cancer. The term abdominal in the name refers to the surgical approach where the incision is made in the lower belly. This is different from other types of hysterectomies, such as vaginal hysterectomy, where the uterus is removed through the vagina, or laparoscopic hysterectomy, which is done using small incisions and a camera. Why is an abdominal hysterectomy performed? Doctors recommend hysterectomies for a number of reasons. Some of the most common conditions that may lead to this surgery include: Number 1. Fibroids. These are benign, or non-cancerous, growths that develop in the uterus. Fibroids can cause heavy bleeding, pain, and pressure in the pelvic area. In cases where other treatments, such as medications or less invasive surgeries, fail to relieve symptoms, an abdominal hysterectomy might be necessary. Number 2. Endometriosis. This is a condition where tissue similar to the lining of the uterus grows outside the uterus, leading to pain and sometimes infertility. When endometriosis causes severe symptoms that can't be controlled by medication or conservative surgery, a hysterectomy might be recommended. Number 3. Uterine prolapse. This occurs when the uterus slips down into the vaginal canal, often due to weakened pelvic muscles. It can cause pelvic pressure, urinary problems, and discomfort. A hysterectomy may be necessary to relieve these symptoms. Number 4. Chronic pelvic pain. In cases of long-lasting and severe pelvic pain that isn't responsive to other treatments, a hysterectomy can be a last resort if the uterus is the source of the pain. Number 5. Abnormal uterine bleeding. Heavy, irregular, or prolonged periods that don't respond to other treatments might lead to a hysterectomy. Conditions like adenomyosis, where the lining of the uterus grows into the muscular wall, can also cause abnormal bleeding and pain. Number 6. Cancer. Hysterectomy is often used to treat cancers of the uterus, cervix, ovaries, or endometrium. In cases of cancer, more extensive surgery, like a radical hysterectomy, may be necessary, depending on how advanced the cancer is and where it has spread. So, as you can see, the reasons are varied. For some women, an abdominal hysterectomy is a life-saving procedure, especially in cases of cancer or severe, uncontrollable bleeding. For others, it provides relief from chronic pain or other debilitating symptoms that have not responded to less invasive treatments. How is an abdominal hysterectomy performed? In the weeks leading up to the surgery, you may be advised to stop smoking and avoid certain medications that could increase bleeding risk. You will also receive instructions about when to stop eating and drinking before the operation. On the day of the surgery, you will be given general anesthesia, so you'll be asleep and won't feel any pain. Your surgeon will make an incision in your lower abdomen, either horizontally, just above the pubic hairline, similar to a C-section scar, or vertically, from the belly button to the pubic bone. The type of incision depends on the size of the uterus and the reason for surgery. Once the incision is made, the surgeon will carefully separate the uterus from the surrounding structures. If you're having a total hysterectomy, the cervix will also be removed. In some cases, the ovaries and fallopian tubes may be removed as well, especially if you have cancer or a high risk of developing ovarian cancer. After the uterus is removed, the surgeon will close the incision with stitches or staples. The procedure generally takes about 1 to 3 hours, depending on the complexity of the surgery and whether additional structures, like the ovaries or fallopian tubes, are being removed. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. What happens after the surgery? After the surgery, you'll be taken to a recovery room where medical staff will monitor you as the anesthesia wears off. Most women stay in the hospital for about 1 to 3 days, depending on how they feel and the extent of the surgery. You'll experience some pain and discomfort, especially around the incision site. So your doctor will prescribe pain medications to help manage this. It's normal to have some bleeding and discharge from the vagina for a few weeks after the surgery. However, since the uterus is removed, you will no longer have menstrual periods. Full recovery from an abdominal hysterectomy usually takes 6 to 8 weeks. During this time, it's important to follow your doctor's instructions on caring for the incision, activity levels, and avoiding heavy lifting. You'll also want to avoid sexual intercourse until your doctor gives you the all clear, which is usually about 6 weeks after surgery. It's common to feel tired and weak during the recovery period, but you should gradually regain strength as your body heals. Walking and gentle movement can help with circulation and reduce the risk of blood clots, but strenuous activity should be avoided. Potential risks and complications. While an abdominal hysterectomy is generally a safe procedure, like any major surgery, it does come with risks. These can include bleeding, infection, damage to surrounding organs like the bladder or intestines, and reactions to anesthesia. There's also a small risk of forming adhesions, or bands of scar tissue, that can cause pain or bowel obstruction. Long-term effects of a hysterectomy can include changes in bladder and bowel function. Some women may experience urinary incontinence or constipation after the surgery. These issues often improve with time and can be managed with lifestyle changes or additional treatments if necessary. Life after an abdominal hysterectomy. After an abdominal hysterectomy, you'll no longer have menstrual periods, and you won't be able to get pregnant. This can bring relief for women who've had heavy bleeding or pain, but it may also come with emotional and physical adjustments. If your ovaries were removed as well, you'll experience surgical menopause, which can bring on the typical symptoms of menopause like hot flashes, mood swings, and vaginal dryness. Your doctor may discuss hormone replacement therapy with you to help manage these symptoms. At the end, support is vital throughout the process of undergoing a hysterectomy. This can come from family and friends, but many women also find it helpful to connect with others who have gone through the same procedure. Support groups, both in person and online, can be valuable resources for sharing experiences and coping strategies. Now, we want to hear from you. Have you or someone you know gone through an abdominal hysterectomy? What was your recovery experience like, and do you have any tips for others preparing for the procedure? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.